Hi, Professor Konincx, Dr. Lucia. Would you present yourself with a few words?
Start.
I am Professor of Obstetrics and Gynecology and living in Oxford, and the home story Anastasia is going to tell you. I was trained as an endocrinologist and came later to endoscopy, and at this moment I'm only doing severe endoscopy.
And you, Dr.
And I am an obstetric gynecologist in Italy since 30 years, and I was a pioneer in laparoscopic surgery. I started laparoscopic surgery in the beginning of the 90s, and I performed the first total laparoscopic hysterectomy of Italy in 1992 in my hospital. Then I met Professor Konincx during traveling in the world like a pioneer also, and he was expert in endometriosis, special endometriosis surgery, so difficult surgery I wanted to learn. And we worked together, since we are working together in Rome now, and we operated in all the world to train people and to develop laparoscopic surgery for the treatment of severe endometriosis.
Great. You're not for the first time in Bulgaria. What are your impressions of Bulgarian specialists?
I answer. I was very well impressed. I was impressed. My first, we were together last time for a congress, for a meeting here. It was our first time in Sofia. And we have seen, we met many gynecologists from this country, young gynecologists. They are very motivated, they have very good education, and I like it. I was well impressed. The reason we came back. We promised we will come, we will start this, to do something here for this country, and good impression.
Thank you. Why did you decide to accept our invitation and to operate our patients?
Anastasia was almost giving my answer. When we were here last time, we had a good impression. I think this is basic. We saw that there are a lot of people who are very interested, and we also saw that your professor was motivated in order to get this forward. So, since we are used to travel the world to teach endoscopy, we thought it was useful in order to be here, and so it could be used for everybody. And not only we want to teach it here, but it also gives the opportunity for everybody in order to come to Belgium, UK, to Italy. It's the easiest way for young people to get internationalized.
What do you think of the work of our team during the operations?
You answer?
This was perfect.
Yeah.
You see that everybody is motivated, interested to learn, and those who are assisting, helping, they know what they are doing. And this is, I think the operating team is perfect. There are many places in the world it's not true. I'm not saying where, but...
the work of our team is on European level, or we have to achieve much more?
You are, let me say, I don't know what is European level.
High level.
No. What I say European level, there is a difference between, let's say, when you have a tradition of 30 years of endoscopic surgery and progressively you build, and at the end of the study you have an operating theatre where you only are doing severe endoscopic surgery. This is not yet the case today. On the other hand, there are many places in Europe where endoscopy is done at a lower level. So I think you are within Europe, but in order to have a dedicated endoscopic team and a dedicated endoscopic operating theatre, well, this is something where which will happen in the future.
But the basic is okay. And what is my impression is the people is very efficient there. Everybody knows what to do, and they learn immediately.
How do you both find our medical equipment, especially our endoscope?
Well, the endoscopy what we have today is perfectly okay. There are things where you can always argue, because I'm used to work with CO2 laser. That's one of the reasons we bought the CO2 laser in Rome. When we are traveling the world, most of the time when you go to Moscow, there's no CO2 laser. When we went to Sydney, when we went to many places in the world, there's no CO2 laser. So CO2 laser can be used for endometriosis, but not necessary to have. On the other hand, the equipment is perfect.
Thank you.
It's very good. Olympus equipment today, we use it, the high definition camera is perfect. What is very important in endoscopy is to see very well. And with this, the camera is the most important thing.
We'll make efforts to improve it, so thank you again. Would you give some recommendations to our young professionals?
If I would make one recommendation first for equipment, and that's a difficult one, is that more expensive is not always better. You have to have a system with functions all together and which is complete. But I think there can be, you don't need 25 graspers, probably 2 or 3. If they are well chosen, you can do almost everything. For the young people, we were discussing this before, they need training, half an hour, 1 hour a day. And if the head of the department could introduce some training in animals, like we were suggesting in rabbits, I think this would be really a future for the young people.
Thank you.
Yes, the message is this: it is very important to train, and to have a good tutor also. What I was suggesting before to the young colleague I have here that are excellent, very good, is that they start laparoscopy with the basic, with the simple cases, but they have to do, and they have to know their limit, and to do diagnostic laparoscopy when this is too difficult and they are not confident to do because they need more experience. They have to ask somebody to do, and they have to be there. You know, and progressively they will improve and they will do more and more and more. This is like we did, and the best is to have the right tutor, and the message I want to give them time to time, like today. They have an expert like Professor Konincx here, and they will learn a lot today, and next time they know what they have to do in a case like this.
Thank you both for the interview. It was a pleasure. Are we finished?
Yeah.